Hi, it's Dr. Robert Brueck coming to you again with another segment of What's New in Cosmetic Surgery. I want to give you a few updates about some of the new things that we're going to offer in our practice. One of them is available right now online at beautybybrueck.com, and it's Zwivel. The way you spell it is Z-W-I-V-E-L. Who knows? Maybe in some word games they might ask you what Zwivel is. But anyway, what Zwivel is, it's a way for you to do an online consult from a remote site. For example, you may be a patient, potential patient in Ohio, coming down for the winter and would like to consider some cosmetic surgery. So you can go to my website, click on the Zwivel link, and download information, including photographs, and send it to me. And then I can give you a preliminary idea of what we might do, options, pricing, the whole 9 yards. And so it's a convenient way for you to get a head start, if you will, on a cosmetic consult. Another thing we're going to be adding is micro needling. It's a great technique wherein we have a handheld device that will do micro needling with PRP, platelet-rich plasma. This can be used for stretch marks after pregnancy, acne scarring, complexion problems. It's an exciting new technology. We're going to be doing a blog on it. There will be some more information available in the not-too-distant future on the website. The other nice and exciting thing we're going to be offering is tattoo removal. A lot of times people come in, they have regrets about a tattoo. Maybe it's the name that's on the arm or the leg, and it's not the person they intended to marry and ended up with, and so consequently they want to remove it. Well, this is a non-laser tattoo removal that removes the pigment and dye from the skin. Many times people have reactions to tattoo dyes because they're non-regulated. They're not regulated by the FDA. This particular thing is FDA approved, and it's a micro pen technique to remove. It involves several sessions, but it's a nice way to remove unwanted tattoos and improve their appearance. The next thing I want to talk about is some of the new technology today. You know, so much of the new technology today really is out there, and I think as a consumer you have to be careful. One of the ones I want to talk about today is called Triactive. And what this is, it's a diode laser suction cooling device. The main purpose is to go ahead and eliminate unwanted fat, cellulite, whatever. And usually the treatment protocol with Triactive is twice a week for about 6 weeks. And the results in a study showed that only about 20% of people showed any kind of significant improvement, and 30-some% showed some decrease in circumference of their thigh diameter. So again, it's one of those technologies that maybe might work, maybe might not work, but in my practice I try to get technologies that will improve the situation 70, 80, 90% of the time. I want my patients to be happy and to be satisfied. I recently read an article about micro-fat grafting in the face. Now, I've discussed this with you before, but in the past, many times people have features on their face they want to change. For example, they may have a recessive chin. They may have recessive cheekbones. And a lot of times people have had to resort to what we call orthognathic surgery. That is where you do osteotomies, you cut the bone, advance the jaw or the cheekbones, whatever. This involves a tremendous amount of surgery, expense, swelling, potential risks, whatever. And there was a study done in Switzerland where they did micro-fat grafting to enhance the chin and the mandible and the cheekbone. And I do this many times. Like I said, about 60–70% of the time I do micro-fat grafting, and the results were really pretty remarkable. Rather than go through long, lengthy orthognathic surgery and the risks associated with it, people are now taking fat from, let's say, their stomach or outer thighs and utilizing it to restore a more youthful appearance to their cheekbones, their mandible, their chin, and it really is a nice technique. And a lot of times, like I said, we combine it with a facelift. Another technique that I read an article about had to do with the revision of saline implants. We see fewer and fewer women with saline implants. But these physicians up north, what they do in their revision, I think it was out of Dallas, they did a report on about 30 to 40 women who had saline implants in. And what their protocol is to take the saline implant deflated about 4 weeks before the surgery. Now what this does is this allows the ligaments and the tissues to contract and be in a more normal state. Then about a week before the surgery they come in for reevaluation. And then at that point in time, I think a patient will have a better idea. Do I want to have new implants put in? Do I like the size of my breasts? I just want them lifted. Do I want to put a little fat into my breast? Do I want to have a smaller implant? It gives a patient an opportunity to adjust to their new size. And then the surgeon, in conjunction with the patient, will then decide and design an operation to satisfy their needs. So they deflate it about 4 weeks before, a week before the surgery, have a second consultation, followed up by the surgeon a week. And it makes sense. I mean, a lot of times people come in when I do implant exchange, well, I don't know if I want to be bigger, I don't know if I need just a lift. And so this is one way, if they have saline implants, to help them adjust to their new size and make some ideas and recommendations as to which direction they might want to go. Another article I read recently came out of Belgium, and you know, I do what I call a composite aug, and what that is, it's an augmentation that I enhance with the patient's own fat. So for example, a woman will come in, she'll want a breast augmentation, doesn't have a lot of fat, so soft tissue coverage to the implant. So we'll suction fat from the flanks or the thighs or the tummy, and I'll augment it around the implant to make it softer, more natural. This was a series of patients in Belgium where you know, a lot of plastic surgeons there now are taking old implants out. Rather than replacing them with a new implant, they're taking the implants out and augmenting the breast with the patient's own fatty tissue. And the size ranged from 300 to 600 cc's of fat per side. So it's a way for somebody to get a more natural look, if they will, to their breast. Now, it's important to understand that when you do this, the patient has to have enough extra fatty tissue to go ahead and replace the implant. Some of my experiences have been such that patients don't really have enough fatty tissue to replace an implant, or for example doing a buttock lift where you want to augment the buttock area with a patient's own fat. I always tell people what I get out is what I put in. I can't go to Home Depot or Lowe's and buy a pound of extra fat. So it's important for patients to understand that can be a very significant limitation in doing this new type of surgery. But more and more we're doing fat grafting to the breast, and I'm doing it more and more now on primary augs, and it's really an exciting technique, and I think offers a nice alternative for women who need extra soft tissue coverage. Another question that people come in when I do breast augs is they'll always ask me about implant shape. You know, we have the low profile, moderate, high profile, and of course the anatomic. And there was an article recently where a surgeon did about 60 implants. 33 were round, 27 were anatomic. So then what he did was he took pictures of these patients just before and shortly afterwards, and about 3 months after their surgery, and gave it as a review of 22 board certified plastic surgeons to see if these surgeons could detect which implant was round versus which implant was anatomic. And guess what? They all looked pretty much the same. They all had excellent cosmetic outcomes, and they couldn't distinguish between the round and the anatomic. And there was a study done about maybe 5-6 years ago where a physician got mammograms on people that had implants. Some were anatomic, some were round, and he got a mammogram in 3 months and 6 months, and what he found was that all the anatomic implants were no longer anatomic, but they were round. So I tend to think that it's kind of a moot point as far as anatomic or round. People read a lot of stuff online and think, I want an anatomic implant, but I think at the end of the day, it really matters very little as far as your final aesthetic cosmetic outcome. Another interesting thing was the idea of music. Now, I'm one of these guys in the operating room. I always like to play music, and I play music almost routinely. I think it's very soothing, it's very relaxing. And they did a study. What they did was they took some residents, and they took 15 of them, and they split them up, and half listened to music, half didn't, and they created some wounds on pigs' feet. And then they monitored two things. Number one, how long did it take the resident to sew up and repair the wound on the pig's feet? And then they measured the quality, which was evaluated by a board-certified plastic surgeon. And they found that the physicians who listened to music had about 8% less operating room time than those that didn't. And at the same time, they felt that the quality of repair was greater. So the music was pretty interesting. In UK, they did a study. 90% of plastic surgeons listen to music. And again, for me, I think it depends on the type of music. I'm not a punk rocker, I'm not Metallica or anything like that. I like to listen to soothing Christian music, and I think it creates a great environment for me to go ahead and do my surgery. So I listen to music, and I think it's a great adjunct. And it was interesting that somebody actually did a study to decide what the effects of music were on plastic surgery outcomes. Now, in October, in just a few weeks, we're going to have our annual meeting of the American Society of Plastic Surgeons in Boston. So there will be a lot of new and exciting things coming out of that meeting, and we'll be giving you a full report. And again, I'm going to be talking to you more and doing some blogging on microneedling and the new technique for tattoo removal. So by all means, check in on my blog site, check in on the website. And again, if any of you have questions you want me to address or answer, you can contact me in my office, 239-244-2329. Or just go to Beauty by Brueck and email me with your questions, your requests, and I'll be happy to get back to you. So have a wonderful week. Thanks again for taking the time to listen, and hope your week is filled in a special way with happiness, joy, and health. Thank you.